activate your inner healing powers. Yeah. So why breathing, dear friends? Out of many things, why are we talking about breath? Breathing is a pillar of your health. It's literally a pillar of your health, dear friends. When you can't breathe, nothing else matters. Given by American Lung Association, you can live 2 weeks without food, 2 days without water. You cannot live more than 2 minutes without air. What is the most essential thing in your life? If you don't have for next 5 minutes, you don't have life. What is that? Air, exactly. Right? 70% of the toxins will release through your breathing, dear friends. If you're not breathing properly, you're not eliminating the toxins properly from your body. Those toxins get accumulated and turn as disease, including cancer, dear friends. Life process is functionally operated till the while your life force is in the body, dear friends. Imagine there is a dead body next to me. There is a dead body next to me. Both of us has body. Both of us has eyes, skin, mouth, teeth, ears. What's the difference between dead body and me? Breath. Dead body can't breathe. Dead body can't breathe, dear friends. No life, no pram. What is the first thing anybody put when anyone goes to the IC room? What's the first thing doctor put when you go to the IC room? Oxygen mask. Until you breathe, doctors can do anything. The moment you stop breathing, doctors can't do anything, dear friends. Oxygen is one of the best detoxifying agent. Then what is breath flow? If I ask you a silly question, how many of you are breathing here? How many of you are breathing? All of them. Yes, yes, yes. Me, everyone. God. Then why are you here? You're already breathing. It's not about breathing, dear friends. It's about channelizing your breath, the flow of your breath. That is what we are going to master in these 2 days. This is a breath flow mastery workshop, right? The flow of breath should be uniform, rhythmic, long, slow, and deep. This is what we are going to achieve in the next 2 days. What are the factors that disturb the oxygen flow? Shallow breathing, mouth breathing, breath holding, rapid breathing, irregular breathing, incomplete exhalation, and chest dominance are some of the factors that disturb the oxygen flow into your body. Breath flow is a system which we have developed to make your breath prana rhythmic, healthy, long, slow, and deep. This is what we are going to achieve in these 2 days. So before I go forward, can I introduce myself? Who am I? Why am I doing all of this? Thank you so much. It was the year 2005, dear friends. I was in my 8th grade. Can you see left side of my nose, which was growing bigger and bigger and bigger? I was an underperforming student in my school. There was a lot of pressure from my parents, my teachers, my school, my tuitions. Every day I used to live with fear. That fear and anxiety got accumulated and turned as breathlessness issues and asthma. Since then I was on medication, taking the pills in the morning, in the evening. Out of 365 days, I used to have running nose for 300 days. My parents took me to the best of the best hospitals, best of the best doctors in Andhra Pradesh and Telangana, dear friends. None of them were able to help me. None of them were able to help me. simple self-healing tools. I want to help you all to heal yourself. Help your family members with this empowered knowledge. If you get empowered, you can help your family members. Your children might be going through the stress issues. If your children might be going through the tension issues. Your parents might be going through some issues. But if you can able to empower, you can help your whole family. Help your family and help the world. How many of you want to be part of this mission? Type I in the chat box if you want to be part of this mission. Thank you so much. Today my mission is to create anxiety-free medicine-free India by using breath healing methods and empower every Indian with these breathing tools. Deep gratitude to all my gurus, Dr. Hansama, Blaisinger, Padmashri Makangunde, Charmati Desai. I done certifications from Baba Saheb Ambedkar University, Kaivalya Dhamma, the Yoga Institute, Heartfulness Institute. I also got recognized by Ministry of Ayush, Government of India as a wellness instructor, dear friends. As a wellness instructor. I completed my bachelor's degree. I followed the same template what South Indians follow. So what South Indians follow, I have followed the same template. Completed my bachelor's and went to abroad to pursue my master's. I completed my master's. I started working over there. While I was in Europe, I started spreading this knowledge. Dear friends. I had students from 52 different nationalities. I represented India in Netherlands as well as in Italy. I have also given a radio show at Radio Roma Capitale in Italy, the capital city of Italy, the Rome. Dear friends, if you take this workshop seriously, it is going to transform you completely. And if you don't take it seriously, you will be at the same place. If you want different results, you have to do the different things. By doing the same things, you cannot expect the different results. Again, I'm repeating. By doing the same thing, you cannot expect the different results. By breathing in the same way, you cannot expect the different results. If you want different results, you have to do the different things. That is what we are going to teach you. Okay? So let me show you some case studies just to build the trust how people got transformed after this. Prabjot, before coming to workshop, he thought whether this will work or not. He just joined because it's just 99 rupees. He was suffering with anxiety, fear, back pain and gastric issues. Within 1 month, he was surprised it's gone. His back pain gone within 15 days. Under Radha Nagarajan. He got relieved from sleep apnea and feeling energetic. He was having episode of sleep apnea during sleeping and snoring also. Snoring and sleep apnea gone within 21 days. Another lady, she was having COPD. COPD is a dangerous lung problem. Her lung capacity went down to 58%. After implementing right way of breathing, it got improved to 64%. 64% difference. And Srinivasanji, his acid reflex gone, palpitations gone, blood pressure has become normal, and shortness of breath is gone by just implementing right way of breathing. How many of you want this kind of result? Show me like this. If you want this kind of results, you have to focus on your roots. This session is not to cure your asthma, not to cure sinus, not to cure your IBP, not to cure your diabetes, not to cure your anxiety. This session is to cure what is causing those problems. This session is to address the root cause of the problem. If you want to address the disease, go to the doctor. He will write a medicine and take that medicine. But if you want to address what is causing the problem, you are at the right place. If that is okay with all of you, type okay in the chat box. Thank you so much. If you want to address the disease, they'll give you blood pressure tablet. If you have blood pressure, they'll give you blood thinners. So you can use that blood thinners. It will help you to thin your blood and flow your blood. But if you want to address what is causing that problem, you are at the right place. Okay? Perfect. Thank you so much. And secret number 1, today we are going to learn breathing health self-assessment. How many of you here would like to know the mistakes you are making while you are breathing? Mistakes you are making while you are breathing. Thank you. For this we need a pen and paper. You can grab your pen and paper. I am going to ask you 5 questions. Okay? For each question, what is the score you would like to give? 4 is the highest, 0 is the least. Okay? Hope you all are ready with your pen and paper. Type ready. Or you can even take the question I'm going to ask you, what is your breathing rate? How many breaths do you take in 1 minute? How many breaths do you take in 1 minute? Okay? So the timer, just count the number of times you are breathing in. Do not close your eyes. Do not change the way you breathe. Do not close your eyes. Do not change the way you breathe. Okay? The timer starts now. Stop. Type in chat box. 40, 30, 25, 12, 36, 16, 26, 42, 15, 25, 23, 22, 21, 22, 24, 45, 15, 33, 14, 60, 28, 32, 16, 12, 22, 44, 25, 29, 20, 17, 21, 23, 60, 25, 40, 69, 28, 39, 27. Got it. So let's see, where do you stand? Is your respiratory rate within the normal range? What is normal range? 12 to 15 breaths per minute. If it is 15 or less than 15, give 4 marks. If it is above 15, give 0 marks. If it is 15 or less than 15, give 4 marks. If it is above 15, give 0 marks. That means you are over breathing. You are breathing a lot. Hyperventilated. How overeating is harmful? Overbreathing is also harmful. Okay? Next question. Everyone place a palm on your belly. Breathe in. Breathe out. Now tell me, while you are breathing in, is your belly coming out, going in, or no movement? If it is coming out, type O in the chat box. If it is going in, type I in the chat box. If it is no movement, type NM in the chat box. NM means no movement. While breathing in, is your belly coming? For Rama, it's going in. For Bala, it's coming out. For Om, it's coming out. For Rima, it's going in. For Banu, it's coming out. For Raman, it's coming out. For Tanay, it's going in. For Raj, no movement. For Hari, it's going in. For Hina, it's no movement. For Gopi Krishna, it's coming out. For Prithvi, it's coming out. Vivo, it's going in. Vaishnavi, it's going in. Tanay, it's going in. Geeta, coming out. Vishali, it's coming out. 1 plus no movement. Usha, P Usha, it's going in. Chitra, coming out. Going in. Like for HP, it's going in. For Nirmala, it's going in. For Sri, it's coming out. For Ashish, it's coming out. For Shiva, it's going in. For Harini, it's going in. For Manimuttu, it's going in. So what's the right answer? Our lungs are like balloon. What happens when you blow the balloon? It expands. If your belly is going in or no movement, that means you are having dysfunctional breathing. Because you are inhaling, you are creating the pressure, the belly should come out. It naturally should come out. It's the natural way of breathing. If it is going in or if it is no movement, that means you are having dysfunctional breathing. Dysfunctional breathing, dear friends. Okay? The third question. Everyone. So if it is belly is coming out, give 4 marks. If it is going in, 0 marks. If it is no movement, 0 marks. If it is no movement, 0 marks. Okay? You can note it down in your book. Third question. Posture. Throughout the day, are you sitting upright or are you slouching? Are you sitting upright or slouching? For example, when you're slouching, you're compressing your lungs, the lower lobes of your lungs. This part of the lobes you're compressing. Can the air enter here? Consider this is a water pipe. If I press the water pipe like this, can the water flow properly? You're not allowing the air to breathe. That's why you see children get a lot of breathing issues because their postures are wrong, they hold the bag weight and all of this. Right? So if you're sitting upright, give 4 marks. If you're slouching, 0 marks. If you're doing both, 0 to 4. Whatever score you would like to give, 0 to 4, you can give that. Next question, mouth breathing. Do you sometimes breathe through your mouth as you go about daily activities or during sleep? Even during the sleep? If yes, a big 0. If no, 4 marks. Mouth breathing is one of the worst breathing habit on this planet. You will get the diseases from dental problems, gum diseases, to throat problems, to lung problems, to digestive problems, to elementary problems, what not. You are inviting all the problems into your incoming call. So always remember, all of you, nose is for breathing, mouth is for eating. Can you eat with nose? And why are you breathing through mouth? There is a purpose God has given the nose, right? And fifth one, shortness of breath. Have you ever experienced shortness of breath, especially during the physical activity or while at rest? While climbing the stairs, playing with kids, doing household activities. If you have experienced shortness of breath, give 0 marks. If no, 4 marks. Mouth breathing 0 marks, nose breathing 4 marks. Okay. And here also if you are experiencing breathing difficulties, 0 marks. If no, 4 marks. Now tell me, what is your full score? What is your full scores? 8, Apurva it's 8, Nitin it's 12, Sushant it's 8, Devadatta it's 4, Nalini it's 12, Vivo it's 10, Ajay 8, 6, Hari 14, Titi 4, Vidya 8, Ramanan 14, Murugan 8. God. Manjula 0, Ramaswamy 11, Sindhu 7, Rahul 4. God. Let's see where do you stand. If your score is less than 10, that means you are in red zone. Your breathing quality is worst. If your score is 11 to 17, that means you are in amber zone. Anytime you can fall into red zone. You both don't know how to breathe only. You attract many health issues because of irregular breathing habits and everything. Even if I give you the breathing exercises, you may not get any benefits because the process of breathing itself wrong. The way you are doing pizza, it's wrong. How can you expect the pizza to be tasty? The way you are making dosa is wrong. How can you expect dosa to be tasty? Right? Same happens here also. If your score is above 17, that means you are in green zone. Pat on your back, you are doing awesome, or you are doing awesome. But if you still have any health issues, you need to learn how to channelize your own breath to heal your diseases. That is also we are going to cover here. So this is a breathing health diagnosis. How many of you found this segment useful? Type useful in the chat box. Now you know the mistakes you are making while you are breathing. Perfect, very useful. Thank you. Now let me show you another case study. Shalini ji has implemented right way of breathing for 30 days. She is feeling great and light, more energetic and getting sound sleep. She lost 4 kgs in 30 days. Can anyone tell me how she lost weight by oxidation, digestion, metabolism, body metabolism got improved, good blood supply, digestion, burning the fat. Exactly. We are not addressing the weight problems here. What is causing the weight? How many of you agree your sleep plays an important role in your weight loss? Yes or no? In weight management. Not only weight loss, weight gain also. Yes. How many of you agree your stress and anxiety plays an important role in your weight management? Yes. She was able to reduce her stress. She was able to sleep better. How many of you agree your metabolism plays an important role in your weight management? Yes or no? Through breathing exercise, her metabolism got improved, sleep got improved, stress got reduced. How many of you agree your cravings increase the weight management? Right? Next, her cravings got reduced because she has become more conscious now. Exactly. That's how she lost the weight. So we did not address the symptom of weight. We addressed what is causing the problem of weight gain. Yeah. So that's why I'm again telling you, this program is not for the symptoms. If you have symptoms, go to the doctor. Is the best person to give the medicine. But if you want to address what is causing, you are at right place. Vijay Sri was having pulmonary hypertension pressure of 70 plus. 70 plus. Right? So after implementing right way of breathing, her pulmonary hypertension got reduced to 58, dear friends, in 21 days. That's the power of breathing. And Kinner, his snoring problem gone. How many of you here struggling with snoring? Type in the chat box if you are struggling with snoring. Many people are snoring nowadays, which leads to sleep apnea also. The chronic snoring leads to sleep apnea. Snoring is also one of the dangerous problem. But many people feel guilty of telling about their snoring. Then how will you cure? 30 days snoring gone, anxiety gone, immunity has increased, improved sleep quality, lung strength has improved, and has concentration stress got elevated by just implementing right way of breathing, dear friends. Mastering the breath flow can help you to reverse many diseases. Right? So there are three important conditions. There are three important conditions to improve the oxygen flow into your body. Oxygen flow into your body, dear friends. The first one is the respiratory path must be clear. The respiratory passage must be clear. Then second condition, the respiratory muscles must be strong. There are different muscles which is supporting in your breathing. They have to be strong so that you can expand, you can breathe properly. Then the third condition, the lungs must be healthy, dear friends. The lungs must be healthy. So, dear friends, we all have three vital bodies: gross body, subtle body, and castle body. This is a very, very important concept. If you understand this, your healing becomes easy. Anyone, tell me, how many of you here went to the doctor? Doctor did all the tests, all your reports were normal, but you don't feel normal. Anybody here like that? Reports are saying normal, but you are not feeling normal. I mean the chat box. So many people. Second condition, you went to the cardiologist. He has to go to the pulmonologist. You went to the pulmonologist. He has to go to the neurologist. You went to the neurologist. He has to go to the psychologist. You went to the psychologist. He has to do that test, this test, this test, that test. How many of you are wasting a lot of money, lot of time for not knowing the problem and not knowing the problem? This might be the reason. Actually, you have to celebrate because your problem is not in the body. It's only in the mental level. It did not manifest in the physical level. It's easy for you. Okay? This might be the reason because they were testing in the gross level. Physical body, there is no problem. Tell me, is this mobile phone useful without Android or iOS software? Is this useful? The problem might be in the software. Pranamaya, Manomaya, Vijnanamaya, Kosha. Subtle body. Okay, you have mobile phone, you have software. Is it useful without battery? Is it useful without battery? The problem might be in the battery, which is Anandamaya Kosha. These three bodies are divided into 5 koshas, dear friends. Annamaya, Pranamaya, Manomaya, Vijnanamaya, Anandamaya Kosha. The first one is Annamaya Kosha, the physical body, which you can see. You can see me, right? So my physical body you can see. The problem might be here. Physical body, sense organ interaction with external world here. Then we have Pranamaya Kosha, the vital body, the energy body. What is the difference between a dead body and normal us? Dead body don't have prana. The problem might be in the vital energy, prana. Right? responsible for life force, breath, subtle psychological processes, energy circulation. Then we also have mind, where we are getting thoughts, emotions, memories, desire, ego. The problem might be in the mental level. Then we also have Vijnanamaya Kosha, intellectual strength, another layer of our body. Discrimination, intuition, intellect happens here. Then we also have Anandamaya Kosha, the bliss body, pure bliss, transcendence, spiritual awakening, connection with universal consciousness happens here. Right? So tell me, which level did you feel stuck? 1, 2, 3, 4, 5. Which level did you feel stuck? Pranamaya Kosha, Manomaya, Pranamaya, Annamaya, Pranamaya, Manomaya, Manomaya, Vijnanamaya, Pranamaya, Manomaya, Vijnanamaya. 1, 2, 3. Annamaya, Pranamaya, Manomaya, Vijnanamaya, all koshas. Manomaya, Pranamaya. Got it. Let's take an example of anxiety, a Manomaya problem. How many of agree the person who has anxiety, it's 100% guarantee that they'll have gut health issues? 100% guarantee. Annamaya also got affected. The person who has anxiety, his breathing will be irregular. How many of agree with this? Shortness of breath, short breaths, fast breaths. Pranamaya also affected. The person who has anxiety, can he make decisions properly? Vijnanamaya also got affected. The person who has anxiety, is he at Ananda bliss? Ananda also affected. How many of agree? If one affects, everything affects. Everything is interconnected, dear friends. Interconnected. You might be seeing your body different, but not here. How many of you would like to heal in these 5 areas? Type 5 in the chat box. I'm going to take you from one layer by one layer by one layer. Okay? So by end of tomorrow, you will be at Anandamaya Kosha. We'll start with the Annamaya today, and by end of tomorrow, you'll be at Anandamaya. Do you know the capacity of our lungs, dear friends? The capacity of our lungs is 5.9 liters. 5.9 liters. Do you know how much we breathe usually? 500 ml, which is less than 1/10 of our lung capacity, dear friends. Less than 1/10 of our lung capacity. 90% of the waste is eliminated through your lungs. We use only 30% of our lung capacity. Our bodies are filled with toxins because of multiple reasons. If you want to reach your goal, you should have a healthy body, not a sick body, dear friends. You should have a healthy body, not a sick body. You cannot become Virat Kohli by having sick body. What we are going to do? We are going to work on engaging the different lobes of our lungs. Due to wrong breathing habits, shallow breathing habits, there are so many dormant regions in our lungs which are unutilized. These exercises will help you to activate the different lobes of your lungs. Right side we have 3 lobes, left side we have 2 lobes, so that you can able to breathe better. And we are also going to focus on increasing the efficiency of your respiratory health by using the respiratory muscle training. By using the respiratory muscle training, dear friends, there are different muscles which is contributing. No? So Dr. Stephen Lin said, before, if you want to live longer, there is one factor above all that can extend your life expectancy. It's your lung capacity, dear friends. If your volume of lungs decreases, the risk of dying heart failure drastically increases. Risk of dying heart failure drastically increases, dear friends. Now let's move to the practical aspect of this. I want all of you to be on camera so that I can see you whether you are doing correctly or not. I know that you have paid 99 rupees, but I want all of you to attend like as if you have paid 9,999 rupees. How serious you will be. Whatever I'm teaching is my 10 years of experience and talk to more than 1,50,000 students. 1,50,000 students, dear friends. Right? So what is the price of movie ticket in your place? Cricket match? Type in chat box. 250, 300, 200, 250, 300. We are charging less than a movie ticket, dear friends. you're charging less than a movie ticket. One ticket, whole family, 2 movies, today and tomorrow. Whatever you watch in the movie, will that be useful for rest of your life? But whatever you are learning here will be useful for rest of your life, not only for you, to help your family, to guide your family members also. Okay? So let's begin. So please come on camera, please sit comfortably. The first thing we are going to do today, before we go forward. Many people, the moment I ask them to do any breathing exercises, they put lot of tension in their shoulders, their neck, and they put lot of tension in their chest region. The more tension you put, you're not allowing the oxygen to flow properly. That's why it's very, very important to breathe in a calmer state. Otherwise, it will be like you are not allowing the oxygen to distribute properly, because blood is the carrier of oxygen. Blood flow gets disturbed. To release this tension, the first exercise we are going to do today is the tapping technique. Tapping technique will help you to release the tension and help you to practice better and experience better whatever we are doing, so that you can able to breathe better. So everybody sit comfortably. Stretch your left hand forward. Make a cup with your right hand. Start tapping. Tap, 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 tap. Relax. Turn your palm. Tap, 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 tap. Thumb up. Tap, 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 tap. Down. Tap, 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 tap. Opposite hand. Tap, 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 tap. Turn your palm. Tap, 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 tap. Thumb up. Tap, 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 tap. Down. Tap, 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 tap. Tap on your chest, on your belly, on your back, on your face. Relax. Your neck, and tap it on your head with your fingertips. Tap it. Tap it in your sides, back side. And relax. Very good. And before we go forward to the next exercises, few things you have to remember. The first thing is keeping your spine erect. You have to sit comfortably, you have to sit straight. How to make our spine erect? Interlock your fingers, stretch your both hands up, lengthen your spine, look forward while exhaling, hands down. So this is the erect position you have to maintain. And also another thing which you need to remember, do it as per your capacity. Do not overdo. Some people have knee pains and they sit on the floor and they hurt their knees. You don't need to sit on the floor. You can sit wherever you can. Okay? And do it as per your capacity. Do not overdo. Do not force your body. Listen to your body. And what was the first condition I have mentioned? There are 3 important conditions to improve the oxygen flow into your body. What was the first condition I have mentioned? No. Clear passage. Very, very good. Very good, Ashish. Respiratory path must be clear, dear friends. Respiratory path must be clear. First exercise we are going to do for that. Who should not practice this? Children below 10 years. Okay? People who are having heart problems, high BP, pregnant women, menstruating women, hypertension, high BP, heart problems. If you have ulcers, you should not practice this. And if you are having any hernia problems, hernia also, you should not practice this. Rest all can practice. Again, do it as per your capacity. Only this exercise is the toughest exercise. After this, everyone can practice. Only this exercise they have to avoid, but rest of the exercises, whatever I'm going to teach, they can practice. Yeah. So how to do this? Just follow my instructions. Just observe my instructions. First, we have to close one of our nostrils, and we have to do quick inhalation, quick exhalation from opposite nostril. Quick inhalation, quick exhalation. Only engaging your neck muscles. Try not to engage your belly. Do not engage your belly. Only how to engage your throat muscles. Okay, so just let me show you. So this part is moving. Belly also slightly moves, but not dominant. Dominant is this part. Okay, so let me show you the sound, how the sound comes. Like this. Okay, quick inhale, quick exhale, quick inhale, quick exhale. Keep doing. So let's do this. Close one of your nostril. Close one of your nostril. Quick inhalation, quick. Do not press tightly. Some of you are doing this. Gently close it. Gently close it. Breathe in quickly. Breathe out quickly from up. Now change. Close your right and left and exhale. Inhale and exhale from your right. Change. Just observe the expansion and contraction in your thoracic region, clavicular region. And relax. Keep your eyes closed, normal breathing. Keep your eyes closed, normal breathing. Breathe in and breathe out. And slowly open your eyes. Very good. And now I want to do one bold test. Bold test can help you to understand how well are you breathing. How well are you breathing, right? So what is your breathing quality? Like how much better are you breathing? This is very, very simple. How to do this test? You have to breathe in, breathe out, and exhale. After exhalation, hold it. Breathe in, breathe out, and hold. And depending on your score, how many seconds you are able to hold, we will be able to see how well you breathe. How well do you breathe, right? So let's do this. Children don't need to do this, but about 10 years you can do this. We are just doing the bold test now. So I'm going to turn on the timer. So stopwatch. First, let's all of us breathe in, then breathe out and hold. The moment you feel discomfort, you can release your hands. The moment you feel discomfort, you can release your hand and you can type your score in the chat box. how many seconds you are able to hold. Stop. What is your score? Very good. So let's see. If your score is less than 10, that means you are having severe dysfunctional breathing. If your score is 10 to 25, that means you are having dysfunctional breathing. If your score is 25 to 40, you are having functional breathing, good breathing. If your score is 40 plus, that means you are having excellent breathing. Okay? So this is one of the very, very important test to check like how well you are breathing. Yeah? Perfect. Now tell me, what was the second condition I have mentioned? The first condition is respiratory path. Second condition? What was the second condition I have mentioned? Sorry, type in chat box. What was the second condition? Respiratory muscles must be strong. Awesome. Strong muscles. Very, very good. Very good. Very good. Now tell me, how many lobes we have on right side? 3. Left side? 2. Why 2 left side? Sorry, left side. Why 2? Because of the heart. To accommodate the heart. To accommodate the heart. Okay? As I said, there are so many dormant regions in our lungs which are unutilized. These exercises which we are going to do right now, everyone can practice, including children. Everyone can practice. So these exercises which I am going to teach right now will activate the different lobes of our lungs and help you to breathe better. Breathe better. But there is one factor that defines 95% of the results. One factor that plays 95% of results. How many of you want to know that? The moment I say, so please repeat, please type it in chat box. That is nothing else. It's your focus. Determines 95% of the results. Where your focus goes, type focus in the chat box. Where your focus goes, the prana flows. The energy flows. That grows. If your focus is going towards Instagram, Instagram will grow. If your focus is going towards YouTube, YouTube will grow. If your focus is going towards Aishwarya Rai Bachchan, Aishwarya Rai Bachchan will grow. If your focus is going towards you, who will grow? You will grow. Right? Exactly. That's why the focus plays an important role. You have to focus on different lobes of your lungs so that the channelization of prana, air, moves towards that side. Move towards that side. So, again, sit comfortably, everyone. Keep your spine erect. We are going to do hand stretch breathing. For this, interlock your fingers. Place your palms on your chest. Focus on the lower lobes of your lungs. You have to focus on the lower lobes. Okay? While inhaling, stretch your both hands forward. While exhaling, palms on your chest. While breathing in, stretch your hands forward. Breathing out, palms on your chest. Inhale through your nose. Exhale through your nose. Breathe in. Breathe out. Inhale. Exhale. Breathe in slowly. Breathe out. Inhale slowly through your nose. Exhale through your nose. Breathe in through your nose. Breathe out through your nose. Coordinate your movement with your breath. While inhaling, stretch your hands. While exhaling, palms on your chest. Focus on the lower lobes of your lungs. Breathe in, breathe out. Keep repeating. Inhale slowly, exhale slowly. Keep your head straight, shoulders relaxed, head and neck straight. Last 2 times. Breathe in, breathe out. Breathe in and breathe out. Very good. Next, let's activate the middle lobes of our lungs. For this, you have to stretch your hands in forehead level. Forehead level, okay? So breathe in, stretch your hands in forehead level, 135 degrees. Breathe out, palms on your chest. Focus on the middle lobes. While inhaling, stretch your hands 135 degrees. While exhaling, palms on your chest. Breathe in slowly. Breathe out. Inhale. Exhale. Breathe in. Do it slowly. Breathe out. Focus on the middle lobes of your lungs. Inhale and exhale. Keep your spine erect. Head straight. Breathe in slowly. Breathe out slowly. Stretch your hands in the forehead level. Keep doing, keep doing. Look forward, head straight. Do it slowly, Senthilji. Slowly, more slow. Coordinate your movement with your breath. Do not force. Last time. Breathe in and breathe out. Next, we are going to activate the upper lobes of our lungs. For this, we have to stretch our hands 180 degrees. 180 degrees. Breathe in, stretch your hands above your head. Breathe out, palms on top of your head. Breathe in slowly. Breathe out slowly. Keep doing. Breathe in. Breathe out. Inhale. Exhale. Breathe in for 3 seconds. Breathe out slowly. Inhale up. Exhale down. Breathe in. Breathe out. Breathe in. Breathe out. Inhale. While exhaling, hands down. And now we'll do few more practices in a standing position. In a standing position. So please stand up wherever you are. Those who cannot stand up, you can sit and practice, but others, please stand up. I'm adjusting my camera.